I've come to this really from a perspective of someone who works in a healthcare organization. So I'm going to be talking really from my perspective, my background, working in a large academic medical center, the challenges we face there with bureaucracy, conservative approach, and really the theme of my presentation are things that I've learned in the last 3 years doing social media. I want to start with a little background on myself because I come to this, I think, in a little different path than most people that might be here in the room. I started as a juggler and a street performer in 1980, before 1980. As you can see, I've gained a little weight in the years since then. 1980 to 1994 as a microfilm technician. How many people remember microfilm? Right. That was, of course, the great solution to data overload, and that was going to solve the world. It was very interesting technology, and of course, it had its lifespan. But one of the things that I got, I was working for Bell and Howe, and around 1992, 93, they developed the first optical storage device with scanners and platters, disc platters like this that held 100 megabytes of images. And I had my first exposure to computers and networking and found that I had a real affinity to it, just loved it. Well, that led to the internet in 1994. Now, this is what the internet looked like in 1994. Everybody was floating around in cyberspace on the information superhighway, lots of @ signs floating around. I got to the internet in 94 mainly at the urging of my wife, who is here today for the first time seeing me speak. I think she's here more because we happen to be in New York, but that's fine. I'm really glad she's here. She encouraged me to get my first computer, and we got it, and I got connected to the internet. I was one of the first 300 people in all of Chicago to connect to the internet from home. And it just took over. I was in cyberspace for a couple of years, and all I could think about was the internet. And she encouraged me to quit my job, what I'd been at for 15 years, and figure out if there was a future in this thing, the web. And so, for better or worse, she's the reason I'm here speaking today, and I want to thank you. So for about 5 years, I helped companies get their first website. I helped about 100 companies in Baltimore get their very first website, and found that I really enjoyed the process of talking to organizations and businesses and saying, all right, what is the purpose of your organization? What are your business goals? What are you trying to accomplish? And then figuring out whether the internet would be a good match and how they could use it. So in '99, I found a job opening in the paper, printed paper in the newspaper, for a webmaster position at the University of Maryland Medical System. And that's where I've been ever since. I've definitely found a home there. I started there as a one-person shop, grew it to about 8 people at one point, and really handled everything that had to do with building a full web program. All the technical infrastructure, programming, web servers, built applications, did a lot with search engine optimization, because one of my goals was to get a lot of traffic to our website. And basically through our shop have done anything that would touch on a web program or web service. But about 3 or 4 years ago, social media came along, and that's when I realized we have another fundamental shift in how people are spending time and accessing information. And so 3 years ago is when I started the big list that I keep track of all the hospitals doing social media, and started attending conferences like this. In fact, I think Lee and I spoke together at a conference about 3 years ago. It was the first time I met Lee. So what I want to go through today are the 3 things that I've seen over the last 3 years, sort of built on top of the things that I've seen over the last 15 years that have to do with social media. The first theme is our patients are ahead of us in what their expectations are for us to be doing in social media. One thing I've learned in the last couple of years is that real big change has to come from the top. Folks at a lower level, like myself, might be coming up with ideas and trying new things, but it takes real leadership to make fundamental change across an organization. And finally, the idea that social media is more than the sum of its parts. And I don't know if anyone has heard about this dog Dozer. Has anyone heard of Dozer? A few people here. This was one of the most interesting experiences I've ever had with the web and social media, and demonstrates the point of how you have to have all the pieces of social media, web, communications pulling together for it to work. So, patients expect more than we deliver. There is a real sense that I'm seeing is that inside an insular organization, a conservative organization, there's a feeling that you stay very conservative, you're very slow to change. In fact, I remember a survey, this a couple of years ago, I saw a survey of Australian doctors, and they were asking the doctors what do they think how their patients would feel if they found out their doctor was on Facebook. And they surveyed all these doctors, and the doctors all said, well, our patients would be horrified, and it would hurt our credibility. And I thought, well, why don't you ask the patients how they feel if their doctor's on Facebook or in social media? So there's a survey I want to show you in a minute, but it shows that when it comes to social media, our patients, our audience, our customers, they trust healthcare providers, they're influenced by our messages, they want us to respond, and they want us to support them afterwards in a social media space. And this is all based on a recent study from PricewaterhouseCoopers called the National Consumer Survey and Industry Review, Social Media Likes Healthcare from Marketing to Social Business. This was released about a month or so ago. I'm going to show you some of the data from that. They surveyed over 1,000 consumers, demographic sampling, and here are the results. It's a good survey, and I would encourage you to take a look at it. A good research paper. Consumers are more likely to share information from and with healthcare providers. 61% are likely to trust information that comes from doctors, 55% from hospitals, and they're also likely to share it in information from those sources with their network and colleagues. I think this is surprising to a lot of hospitals, a lot of folks that work in industry, in our industry, that consumers are ready to listen to what we have to say and trust what we have to say. I hope there's no drug companies here today. So, okay. Almost half of consumers said that information found via social media would affect their decision to look for a second opinion. And you can see the different segments there. Seeking a second opinion from another doctor, choosing a doctor. These numbers are pretty good when you think about the limited amount of engagement that most hospitals have in a social media space. They're also looking for these services in social media. So although a lot of these services here are on hospitals' websites or your organization's websites, they're looking for this to be in the spaces where they spend time, Facebook, Twitter, and other places. This, I think, was very surprising, would be very surprising to a lot of doctors. Over half of the patients are comfortable with the idea that their doctor is going to go to online physician communities to ask about their problem. So this view that many, I think, in the medical profession is that they have to put on a front that they have all the knowledge and they don't need to seek any extra advice. I think the patients are saying, well, we know that you don't know everything. We know that it's that you need to talk to your colleagues. And if that happens in an online community for physicians, that's fine. We're comfortable with that. The second theme that I came to realize was that big change has to start at the top of the organization. How many people know what this screen is? How many people work in an organization that blocks social media? Okay. You're not supposed to ask a question when you don't know the answer, so I'm really glad to see this show of hands. This, to me, is the biggest obstacle that we face right now. If we're inside an organization and we're trying to promote the idea that social media has value and can be used to engage with our community, can be used to connect with them, and if at the same time we're blocking Facebook from our staff's desk, well, we're sending the message that we don't trust you, these things are kind of iffy, and you shouldn't be wasting your time here. So one of the initiatives that I worked on very hard in my hospital was to open access. We've been using WebSense since 2004 at our hospital. We were blocking Facebook. We were blocking all the blogging platforms so that if you went to a website that was on Blogger or hosted by WordPress, it was blocked. Social media widgets were blocked. So you'd go to a website that embedded a widget like the Facebook feed or the Twitter feed, and you'd see a blank space here. So this broke a lot of non-social media sites. There were many sites that would not load properly because they had a Facebook widget in the code, and it would time out waiting for it to load. And we were getting lots of complaints from our different staff in HR and media relations and all the different areas in the hospital that needed to go out and use these tools to communicate. So I had to figure out a way of framing this up to make the case. So while we can all speak very easily about the wonderful things around social media, I had to find the things that would resonate with the leadership in our hospital. And it turned out that it was pretty easy. Patient satisfaction was the number one reason for us to open access. Our network is the open public Wi-Fi network that our patients use goes through the same network and pipes as the computers that are on our desk. So our patients were coming into the hospital, sometimes for weeks at a time, and they'd bring their laptop or their iPad, and they'd be blocked from Facebook. So the message we were getting from our patients was, you're blocking me from my support network at the very time I need it the most. It's impacting the way I feel, my ability to recover. So once we framed it up that way, and I talked to our leadership, it was much easier to make the case that we need to make the change. Well, I also wove in other themes, showing respect for our hospital staff. We tell our staff that we respect them, that we want them that they're professionals, we value their judgment, but at the same time we say, no, we don't trust you to be on Facebook. So that's sending a mixed message. And I also repeated the lessons that we learned from the first web cycle. Between 1999 and around 2003, 2004, most hospitals didn't take the web seriously. I would talk to hospitals in that time, and they say, well, yeah, we got a couple-page website, but why should we invest any money in this? Our patients come from the yellow pages. So I was seeing the same attitude happening with Facebook. Now I would get the response from hospitals, well, why should we bother with social media? All our patients come from the website. So I said, okay, let's think back about 10 years. Where were we then? So those were some of the drivers where I would repeat back and say, we've been through this before. We've been at this dance. We had the same issues and objections before. We realized that they weren't as bad. The obstacles weren't as big as we thought. And we moved forward with it. So the process for all of 2010 for me was to get access opened. And anyone who works in a really large organization will appreciate this. Even though our CEO at the beginning of 2010 said, we are opening access, even though everybody in our executive office agreed, HR, legal, even IT, that yes, we need to open access, it still took a year to make it happen in our organization. We built policies, staff guidelines, did a lot of education. And 1 year later, this is a double rainbow. Double rainbows? Okay. This is double rainbow. We opened access on January 1st, 2011. And the results, nothing happened, which is exactly what I told people. We called it a no-drama launch. We just let people know, our staff know, access is going to be open on January 1st. You'll be able to go to Facebook. You've been trained. You know the expectations. We opened it up, and everything went like normal. The building didn't come on fire and collapse into the ground. And what we saw, of course, was very quickly a very rapid decrease in patient complaints, which we were getting on a regular basis. Our employees, of course, were much more aware of all the different social media activities that we had been doing at our hospital. And we really got to a point where we just said, well, sure, we open Facebook. It's not a big deal. We just treat it as business as usual. A real shift for us and I think for any other large organization or hospital that's gone through this. The key factors is that this decision came from senior leadership. We did the risk-benefit calculation, but we used honest math. We didn't let the IT department say, any access to Facebook is a disaster. We said, okay, tell us exactly what is going to be the problem. And we worked through this in a very methodical way. We made sure that they understood that staff is accountable. They've always been accountable. Even if we never opened access, even if we don't have internet access at all in our hospital, staff is still accountable for how they behave on Facebook. There are professional standards to follow. And of course, this whole process involved everybody in the organization, HR, legal, our medical staff, and that was the key part that made it successful. This open access also brought the opportunity for new services. And this is the liver transplant support group. And Janet Gripshover is a nurse practitioner who runs a traditional in real life support group. And she came to me and said, you know, our patients are getting together. They have a very serious condition. They've had a liver transplant. This is a lifelong situation for them. They really enjoy meeting together face-to-face, but some of them are driving up from Virginia to Baltimore. It's very difficult for them to get together. They're asking if we can meet together on Facebook. So we worked up guidelines and policies on how this would work. We now have 4 different Facebook groups for patient support. They are around 25 to 50 members each. We were able to launch it only 3 months after we opened access. We're using closed groups so that you have to be invited, so folks have some privacy in the conversations that they're sharing with each other. And everything is managed through the communications department. We sanction it, we educate the people that are running it, and it's been very successful. We're seeing the standard things that you would expect a group to talk about. Does this happen to anyone else? Are you having problems? And I remember looking at some posts when we had a huge blizzard in Baltimore, and the people were checking in with each other. Do you have power at your house? You know, just that kind of standard community stuff that it maybe didn't even have anything to do with the disease, but they had formed into a tight community. Last part, and I'm really working on Lee AC speed time here, so we're going to have plenty of time for questions. Social media is more than the sum of its parts. And the story I want to show you now is about that dog. And it happened a year ago, about 3 weeks ago, 3 weeks ago. May 15th, 2011, we had the Maryland Half Marathon, which is a 12-mile race in support of our Greenbaum Cancer Center. It's a major race for Maryland, about 2,000 participants. And this year we had this one unexpected guest, Dozer the dog. Now, how many people here like dogs? All right, how many people don't like dogs? There's always one. There's always one. I've asked this question at least 5 or 6 times. There's always one person. Well, you can step outside if you want, because this is going to be a dog love fest, okay? Okay, so Dozer the dog. Let me go to the video. Hang on. So I need to switch to. Okay, here's what started it.
Jamie Fitz. John Kufner.
Okay. Let me get back to my presentation for one slide. Okay. So Sunday, May 15th, on race day, this was a 12-mile course that was going through a suburban neighborhood south of Baltimore. And the race course went past Dozer's house. And Dozer was in the yard, and he saw all these people running past his house. Anyone who has dogs pretty much knows what happened next. He got very excited. Here are these people running. It must be something good. And he went through. He had a little electric collar, and he went through there and joined the race. This was around mile 5. So he ran for 8 miles with the runners. I mean, we have runners that took photos and pictures along the way. And at the end of the course, there was one of the race course officials who was filming people, videotaping people as they approached the finish line. And thank goodness she had the presence of mind when she saw this dog. She just zoomed in on the dog. She stayed with the dog all the way through to the finish line. If that 18-second clip of video didn't exist, I wouldn't be talking about this. We wouldn't have had anything to share. So Dozer joins the fun on May 15th. He comes home the following day because he ran 8 miles. He had to come back, and he showed up the next day at his owner's house. The owner figured out what was going on and contacted us. The owner thought this was an amazing thing, thought it was really cool, and decided, I want to work with the hospital. If we can make something out of this that would benefit the hospital, let's do it. So everything I show you going forward from here was with the blessing and encouragement of the dog's owner. So once we had that, we started contacting the local news media and saying, hey, we've got this kind of interesting, fun story. We've got this short video clip, and you might be interested in it. The video goes up on YouTube, and we decided to create a donation page. So we set up a donation page so that each runner had one, so that you could sponsor a runner. So we, after the fact, set up one for Dozer. On Wednesday, the story started to get picked up on personal blogs. We had almost 500 YouTube views of that first video, and we had almost $400 in donations from 14 people. So I thought, well, that's not bad. On Thursday, the story gets picked up nationally. Fox News, ESPN, Runner's World. We're starting to see floods of blog posts that embed that first YouTube video. And it said, okay, we've got something here. We're going to have to, we got to tell the story a little better. So the race officials met with Dozer's family, gave Dozer a medal. We videotaped that, and which I'll show you in just a minute. And our YouTube videos start to climb up. Our donations start to climb up. Friday, we published the second video, which I'm going to show you in a second. And we start getting attention from the Today Show, Runner's World, and lots of personal blogs. We're now at 65,000 YouTube views. So here's the second video. Now, one of the things that I want you to note in this video is what we saw was that first video was getting embedded all over the place. But that first video doesn't have anything that in the video says who we are or what the context was. We were dependent on whoever was doing the blog post to get the facts right, which is probably not a good thing to assume. So with the second video, we made sure that all the information the person would need was part of the video.
Our Maryland half marathon, come here, sweetie. Our Maryland half marathon finishers medal.
Well done.
Well done.
So As you can see in this video, all the information you need is there in the video. So somebody embedding this on their blog or on a newspaper website, they can't get rid of that information. And so once that happened, we started to see an even more rapid increase in the number of people donating on the foundation page and commenting. Okay, so here's Dozer's half marathon page. We embedded the YouTube video there, and we started seeing lots of donations start to flow in. We decided, this is all within like a space of about 3 or 4 days. We decided, okay, what can we do next? Well, let's create a Facebook page for Dozer. And you might want to notice that Dozer has 16,000 followers at the time I took this screenshot, which I hate to say was more followers than our hospital's Facebook page that we had poured our life into trying to promote. And Dozer got to 16,000 in like 2 days. I mean, it was phenomenal. And of course, we were posting for Dozer. This is one of the times where you do have to have a ghostwriter. And so Dozer was talking about his day and how he was going for a walk and telling people to get out there and exercise and run like Dozer. And he would be liked, hundreds of likes in a matter of 10 or 15 minutes, shared all over the place. So we were having a lot of fun with that. But of course, the big reason we were doing this was to raise awareness about the Cancer Center. This is what it looked like on Huffington Post, the Today Show blog grabbed this story. And we started seeing this show up in what amounted to two very different types of bloggers. There were people who love dogs, and there were people who are marathon runners. And there's not an awful lot of crossover. I mean, there's some, but we were seeing very, very different approaches. So here is Lily the dog up here talking about one of her fellow dogs doing something cool. And then we have, this is just one of the random blogs I happened to find. This is a marathon runner, and this is his personal blog. And I learned a new term called bandits. So, because Dozer was a bandit, because he didn't register for the marathon. He just showed up and ran. And there's lots of conversations from marathon runners about whether he should be disqualified, or a lot of good fun with it. So we're still trying to absorb all this, right? This is all happening in the space of about 3 or 4 days. And the next set of slides, because I'm a data guy, it was the most fun for me. This is what a viral video looks like. Now, the time period I'm going through is from May to the middle of August. And this graph here is all the medical center videos that we have up on the website, about 570 videos. And we get around 2,000 views a day when you put all those videos together. All right, I'm going to have to shrink the scale of this graph. Okay, so that's the same data, but I shrunk the scale. Here's what the first video did over the course of the 2 months. And here's what the second video did on top of that. So we were getting peaks of 70,000 views in a single day. Now, the Mayo Clinic might see that every day, but for us, it was pretty good. So I talk about social media being more than the sum of its parts. And it wasn't just all the different parts of social media. It wasn't just that we had done Twitter and Facebook and we were on YouTube, but it was everything else that the organization was doing as soon as we realized the opportunity here. All the media relations effort that went into this. Working with the fundraising folks, working with the vendor who manages the fundraising site, who had never encountered a sponsor's page that had 700 comments on it, right? The video production, being very fast and agile. We didn't use flip cameras for that second video, but we weren't using $25,000 cameras either. We decided, let's do this video, let's get the little medal ceremony, and we turned that around in a matter of hours. And then, of course, a lot of monitoring. The sum, all the visibility that we had, the international media coverage, over 500,000 YouTube views, but of course the most important part was $30,000 raised from 700 donors just because of this story. So, in summary, The three takeaways. Understand that your patients are far ahead of what we think about in their expectations for social media. Anything that you want to do that's going to be in a large transformational level has to come from the top leadership. So most of your attention on those types of things is best spent educating and convincing them about the value of social media. And remembering that social media is a tool, and it can be used with just about any initiative. Anything that comes along that your organization wants to do, there's probably some aspect of social media that could benefit. And with that, this is my brush with greatness. This is when I got to meet Dozer a year later. So. Now, I promised in my top 10 things of reasons you should be at this conference, I hinted that I might bring Dozer. I wasn't able to do that, but I have something else I wanted to give to Bunny. Susan, if you would, we have a little present for Bunny. This is something that we did at the philanthropy group did for this year's race. Go ahead and pull it out. If you donated $50, you got a Dozer stuffed dog. So. Okay, so we got plenty of time here. This actually went faster than I thought. I'd like to open up for questions, and I'd like to also welcome Lee up. If there's any questions for Lee, let's take it.
Not really a question, but a comment for you, Ed. We too opened up our site last year, and it's really largely thanks to the Mayo Clinic. We went to your social media website, we borrowed and adapted your guidelines for employees, the policies, and having the endorsement of someone like the Mayo Clinic and having your experiences to refer back to gave courage to our senior management team to really go forward. And it was from a patient complaint that she couldn't get to Facebook and share her new grandchild's pictures and so on. So it was really the Mayo Clinic that helped us convince our team to move ahead. So thanks for what you've done and keep doing it.
Well, there's really two issues here. That list that I put together 3 years ago, the real purpose of that list was to empower people like you to be able to go to their management and say, hey, I'm not crazy thinking we should be on Facebook. Look at all these other hospitals that are doing it. That's the purpose of the list. And I have to say the most gratifying thing for me is usually about once a week I get someone calling me and saying, thank you, I convinced my management that we should be on Facebook, and it was because of the list. So that's great. I'm glad to hear that. But that's the second thing now is opening access. So there are a lot of hospitals that have official Facebook accounts, but it's blocked inside. So I think that's the next big challenge.
That was
Right.
the case there. We had one. Our own employees couldn't get it, different concerns, and
Well, good.
the
Yeah,
information
and actually,
shared.
Ed's on our advisory board for our Center for Social Media, and is going to be leading a task force that we have working on this as well, because we've never had access blocked. We've always had access, and so someone like Ed, who's been through the process of getting it opened up and making those arguments, is really helpful, and we just want to help provide more of a platform for that too. So.
Can I ask a favor for people asking questions, since we want to get to know each other? Tell us your name and where your organization, okay?
Yes.
Howard Bucks. You talk about a top-down approach. Obviously, you sort of successful in using more of a bottom-up top that this is actually all their employees have cell phones, so what matter. What are your thoughts with using a bottom-up approach to sort of engage?
Well, obviously, everything that's happened pretty much with the acceptance of social media has been bottom up. It's been somebody in the marketing department or somebody in the media relations department or communications or IT who said, this is really important, we need to have a Facebook page, and they start doing it. Doing it without permission or getting a
Proceed until apprehended.
Right. That technique has served me very well over the years, but there are certain types of things that you can't make happen unless you've convinced the senior management, and opening access was one of those. Because as I talk to hospitals that have this issue, Sometimes it's the IT department that says no, no, no. Sometimes it's HR, sometimes it's compliance. Each one of those departments has their specific mission to serve the organization. And when they look at the risk-benefit, all they see is their risk. You have to go higher and say, yes, they see a risk, IT sees a risk, but here are the benefits across the entire organization that we'll gain if we open access, and for our patients too. And when that comes down, when our management came down and said, this is going to happen, tell us what the risks are, we'll mitigate them, we'll address them, but we're still going to open access. And that's what I mean by having it come from the top.
Tom Bell from Salina Regional Medical Center. We just recently started to open access in response to IT complaints because they're being flooded with requests to make exceptions among the staff when they're trying to do an EMR conversion. So they threw up their hands. As a tip for insurgency. But the other thing is, how do I address concerns from our administration that our community is trending older, and these are not users of social media?
You want to take that? Because I can answer.
You go
Okay.
ahead and I'll chime in.
Well, first of all, I think that if you look at the demographics of social media use, it is really starting to match the demographics of the United States. So that was true years ago, that it was just young kids that were doing these things, but now it's just become an accepted part of how everyone's communicating. The second more important thing is that even if it's the case that 60-year-old, and I hate to say 60-year-old because I'm 55, and that makes it sound like it's a little too close, but this 80-year-old person doesn't use Facebook and isn't on the web, their adult child is. And more, the adult child is managing their parents' medical conditions and medical process. They're on the web, they're on Facebook and so forth, looking up information, trying to get recommendations on doctors. My mother-in-law is in Chicago, and my wife spends some time, a considerable amount of time, talking with her doctors, making sure that she's got the proper management of her care. So that, I think, would be the answer to that.
My dad's 81 and just got an iPad, for his birthday. So I mean, it's and that's the one. It's one anecdote, but the reality is, if there are 900 million people on Facebook, it is a significant chunk in the older group too.
Have any of you who were involved with Facebook about having courses on how to use social media, how to get information to you even have captive audience
Have you done that?
So one thing we've done relating to giving patients access, and Dr. Tamimi is involved in our Patient Family Advisory Council. We'll have him talk about that a little bit, but we have talked with our volunteer services group, so that as they're the ones that are wearing the Walmart-like blue coats when you come to Mayo Clinic and helping people find their way around, but doing some presentations for them to get them familiar so they can help educate patients. But
and we have a fairly large Patient Family Advisory Council group at the clinic, probably about 20 of them in Rochester alone. And we've been using, because so many of them travel for care, Yammer is an internal tool for them, providing both brown bags and training sessions for them. In cardiology, we have patients who travel 4 hours each way for the meetings. So we want to make sure their time spent is appropriate and useful. They have a repository for common data, for comment and discussion. And so we've done that and found it very useful to do as well.
We are also an early hospital that adopted now Caringbridge, which has been around for many years. Mid-90s is when they launched. So we've been offering that to our patients, and many of them say, they like this, even though they're active on Facebook. They like a Caringbridge blog because then they can kind of do a fresh take on who's going to be included. How many people know what Caringbridge is? Okay. So they can do a fresh take on who are we going to include instead of just blasting medical updates to everyone on Facebook.
marketing, communications, and media relations at UHS Advanced. Is your Facebook interactive or static? I mean, do you let patients, community post comments?
Yeah, we have a completely open Facebook page. Of course, we have, a standard disclaimer about acceptable, that this is our sandbox, you got to play nice. We have deleted comments and banned one or two people over the last 3-4 years. It's a very rare occurrence, but yes, we encourage people to comment. We've seen a lot of cases where somebody posts something that we cringe at, but then the flow of messages pushes it down and it just goes away.
Hi, Missy Lucas from Pro Health Solutions. I was wondering, noticing one of the talking points you had on the agenda was finding the ROI balance. Any insight you could offer to that would be great. I'm head of marketing for a company that's always difficult telling and saying, why is the investment worth it?
Yeah, and I apologize for, once this dozer thing happened, I kind of rewrote my presentation, and it didn't hit a lot of the bullet points in there. But actually, the person you want to wait for is Chris Boyer, whose entire presentation is on ROI. I personally don't believe that ROI matters. Chris does, so we have a good competition there. So he'll be able to answer your question much better. My take on ROI is really more not dollars and cents, but well, a lot of ways you can look at it. What's the negative ROI of not doing it? What's the ROI of not being there when a patient has a question, has an issue that needs to be resolved? And then on the flip side of that, all the non-dollar returns, patient satisfaction, service recovery, being able to encourage people to talk about their experiences at your hospital in a public place that other folks can see. And as I've looked at Facebook pages across hospitals over the last few years, 99% of the comments are all positive. So there's this great fear about someone's going to say something bad. But we have years of evidence now, as you look at Facebook's pages for hospitals, people are talking about their good experiences.
Yeah, I'd also just say that with a couple of those charts where I talked about the marketing benefits, I mean, those are things done with a $150 flip video camera, uploaded to our YouTube channel, which we paid nothing for, and, on a $4 a month blog. So when you look at getting, doubling the patients with the split tear, doubling the patients with myelofibrosis, and again, these weren't the only factors, but if you keep the cost really low, then and use this as part of the way of doing what you're already doing, which is that marketing, that if you use this as an additional relatively low cost tool, then it's a lot easier to make that argument.
Plus, I think it's the addition of resources needed to be able to.
Right.
I mean, if
Yeah,
you're
okay, so
buying-
I understand that, but on the other part, I was doing media relations already, okay? I mean, that's what my original job was to pitch stories like the Jason Worth story, except I was worse at it when I didn't have a flip video that I could show him doing it. So it's like, start out with that. So, I mean, prove that, use that to show the benefit, and then you get the more resources. Yeah, now we have 8.1 new people, and that's great, but we were doing it with the 1.5 before. And so whatever that, FTE or portion of FTE you can have that you dedicate toward it, I mean, just take the initiative yourself to say, this is something we just need to do, and we'll figure out, we'll be able to do a lot more if we get more resources, but for now, we need to at least be moving there.
Yeah, well, we literally just launched the Facebook page last Friday. Finally got the.
Excellent, good,
Years
yeah.
to get the okay to do it, but, so now it's the battle.
So everybody, what's the page?
Yeah.
Let's everybody like it,
Can you
yeah.
like the Pro Health Physicians page?
Okay.
Right, but-
Pro Health?
Right, and I'll add you to my list.
But if you look at HCAP's data, right, we all live and die by, the majority of those questions, at least 75%, are on communication skill sets. And to not converse with the patients whom you're caring for, where they're physically at, to improve your policy and procedures to enhance communication is wholly illogical. So part of this is our fault. So we talk about this, but if we don't actually measure what we do and publish what we do, then it's going to be harder for you to get the traction you require. But this is the right thing to do. Sorry.
No, I completely agree.
Okay, well, there at the, okay.
Can you speak a little bit more on
Mhm.
primarily
Yeah, well, as you can see, the numbers are fairly small. We started with groups that were the people who were actually there, actually were our patients, who were coming to the traditional face-to-face meetings once a month. We invite them to come into the group, so we have a really clear management about who's going to be in the group. You just can't go and join it. And in terms of management, the nurse practitioner monitors what's being said, but mostly it's the patients just talking to each other. I mean, these are folks who have had a liver transplant. This is still a fairly unusual treatment, unusual condition in terms of the overall population. They're looking for other folks that have had the same experience, and they're asking that question, has anyone else had this side effect from a drug? Has anyone else had this physical issue related to the transplant? And they talk to each other. It's really fairly mundane. The nurse practitioner monitors it, will post updates about what's going on with new initiatives at our hospital, answer questions, and basically, the management is fairly straightforward. It's something she does, for 20, 30 minutes a day tops.
Okay, we said there for next. No, yeah.
Okay.
Yeah.
So it took you, I just have a question, I guess, about, I'm Cosmo Catalano. I'm a physician practice manager with Berkeley Health Media. And my question is sort of about retaining autonomy. Certainly with Dozer, your ability to react quickly and rapidly as it sort of evolved and went viral was really critical to the success of it. And you've got, I forgot your name, you said it took 2 years to get okay for a Facebook page. And you said it took a year to get all the stakeholders involved in opening access. How do you retain that sort of rapid response time after everyone's on board and wants to say?
Well, I think there were two separate things. Opening access was something that we needed to coordinate and organize across all different functional departments, HR, IT, training in place. Can we flip the switch? What will the impact be? So there was just a lot of that kind of bureaucratic process of getting all the pieces in place, even though everybody agreed we wanted to do this. But in terms of setting up a Facebook page, well, you can set up a Facebook page in 10 minutes once you decide you want to do that. And because we already had an established social media program, that our first Facebook page went up in around 2009. We had a dozen Twitter accounts. We had all this YouTube videos up. Because we already had established that we know what we're doing, and we had a proven track record, saying we want to put up a Facebook page for Dozer was really just a decision we could make amongst ourselves in the communications department and do it. Now, if we never had social media, I don't think it would have happened. None of those pieces. But people saw that, yeah, we do know what we're doing. It's not that crazy. I mean, a Facebook page for a dog, that's a little crazy, but it wasn't pushing the envelope too much.
Yeah, I'd just also say with Mr. and Mrs. Cowan and the piano duet, I mean, the fact that we had we had a Twitter account, we had a blog where that could be embedded. I mean, we had the infrastructure in place, and then it made it really easy to just say, oh yeah, that's a good one, let's put that in, so. Okay, yes.
Jenna Spivak from my Mommy's Medical Center. I think there's a lot of value in reaching out to bloggers. I think there's a lot of value reaching out to bloggers, and I was wondering if you did any blogger outreach for the Dozer story, or if you really just assumed that it would develop organically from the larger news outlets that covered it?
Yeah, well, it went organically, and that chart that I showed at the end with those spikes in traffic, the first spike, and then it was like 4 weeks later, the second spike, and then another 4 weeks, there was a third smaller spike. That was all driven by the mass media. It's like the second spike was when the Huffington Post picked up the story 4 weeks later, and it was on the Canadian cable broadcast company. So that was all media driven, those huge spikes. But there was a constant amount of traffic that was coming from the hundreds of bloggers. Now, we would not invest our resources for a story like this to reach out to runners' blogs or dog blogs. But we would invest resources if we have some interesting story to do with heart disease or orthopedics, to reach out to the premier bloggers in that field to say, we've got this story, would you consider running it?
Adam Figueroa from Monster Medical Center. What's your monitoring strategy? Thank you.
What's the monitoring strategy that you guys use at your organizations, and what tools do you use to carry that out?
My wife is holding up my cell phone. Okay. 24/7. My monitoring strategy is really straightforward. We use Radian 6, which, how many people know what Radian 6 is? Okay. We use Radian 6, which has this enormous, complex, cool dashboard that you can go in that I never use. I have about 100 search phrases that I care about, and Radian 6 every hour takes all the hits, puts it into an email, and I receive the email. I scan the email to make sure there's no problems. And and my wife will tell you, I'm looking at the email all the time, 24/7, and I just scan the email. It shows up the summary hits like a Google search result, and I can just scan it to see if somebody's upset or complaining or if there's something I need to respond to very quickly. That happens like literally once every 6 months. There's something I need to respond to quickly. The other thing is that on my cell phone, on Twitter, anytime someone mentions our Twitter handle at UMMC, I get a text message. Now, Lee couldn't do this, but I can do this with my hospital. I probably get 20 to 30 text messages a day. They just show up, I look at them, glance at them, and delete them. Because, again, most of the time, once every 6 months there's a problem, but most of the time it's either neutral or positive.
Rachel Garrett from the Visiting Nurse Service of New York.
When you have an organization with multiple sub-brands, have you found it more effective to speak, from an enterprise level or, with a more targeted voice for each of those brands?
Very good question. Typically what happens is that every sub-specialty, they want a Facebook page. They don't know what it is, but they want one. So we've got a process that says, yeah, you can have a Facebook page, but first you need to show us that you have enough material. So you send us a post, and we'll put it on our main page. And we need 3 posts a week. That's the absolute minimum for you to have a standalone Facebook page. You send us 3 posts a week for the next 2 months, you'll get your own Facebook page. That hasn't happened yet. Now, we do have a lot of Facebook pages that have very specific purposes. Those 4 different patient support groups. That is a very narrowly defined, very well scoped out mission for that Facebook page. We know who the audience is, and there's somebody there who's ready to run it. But aside from that, and aside from some other small Facebook groups that are actually being in place for employee communication by various departments, everything goes through our main hospital Facebook page.
Do you run, that's a great point that you made. I engage a lot of other providers and small groups trying to get them involved in blog, etc. And I find that they simply don't know how to come up with the content, and don't know what type of content to produce. And they don't understand how easy it is and how simple it is. And that if they simply listen to their patients and address their patients' questions, because they hear the same questions each and every day, day in and day out. So I think that a lot of this falls back on the leadership in the social media community, teaching and educating the healthcare community as to how to produce and what content to produce.
Yeah, I'd also just say we haven't had that. We actually sort of short circuit that process of doing the 3 posts a week for the next 2 months, because mainly when we say, well, you could either start with your page where you have, you'd have like 100 followers, or we've got 90,000 on ours. Which do you think would be better? They're more likely to contribute into the bigger one, and I agree. It's just getting, having people, helping people to understand that it doesn't have to be super profound, especially with a tweet. How profound can you be in 140 characters? I mean, just giving them the, and in our case, what we've tried to do is really facilitate through the flip camera to make it so you just talk about what you're talking about in your regular encounters with patients. What are those questions you're answering lots of times each day? And it works. Okay, well, let's go here and then there, yeah, okay.
Lauren Day, I'm from Philadelphia. I'm actually a patient. I have no other angle. But to Howard's point a little bit, I suppose, Ed was speaking to the top-down approach that you experience, but that patients are leading the charge for you. We heard what the Mayo Clinic's doing and how they're involving their patients and educating their doctors to be involved with their patients. Have you experienced anything with your physicians getting engaged, not just the hospital?
You know, I have to say that we haven't. It's been something that we've had a lot of conversations about, but really the experiences that Lee has shared, I have to say we haven't duplicated at our place yet, but I'm working on it.
And do you know what their hesitance is?
Well, I think it's the same hesitance. I think the biggest one is time. Even though we may think that it doesn't take a lot of time to put something up on Twitter, it does take time to establish a community, to be active in social media. And I think physicians have a very legitimate question of what's the benefit to me? And it is so intangible that until you get past a certain threshold where you're very active. I mean, Howard can talk about the patients that he's tracked that have come to him because of the activity he does on social media, but he's still pretty much the exception. There's another doctor, Brian Vartolbedian, that is another good example, and his advice is that physicians should think about not just getting patients, but also using this as a platform to talk about the things they're passionate about. So Brian Vartolbedian is a pediatric gastroenterologist. He talks a lot about vaccination, and he uses his blog as a forum to educate and promote that children should get vaccinated. Whether it's healthcare reform, there are thousands of different topics that you talk to a physician for more than 5 minutes, you'll find out which one they're passionate about, which one they think is important issues. Well, that's all a good starting point for a physician to think about using social media as a way of engaging their public.
We had one more over here, yeah.
So you're talking about HR's management of? Mm-hmm. Yeah. Well, we have a pretty tight relationship because obviously a lot of the activity that happens with recruitment is on the web. Now it's shifting to Facebook and to LinkedIn more than anything. We actually use an outside resource to help manage those because it's such a specialized area of recruitment. So I sit in to kind of vet the ideas that the agency is putting forward, tweak them and fine-tune them to make sure they'll work best for us. But my role is more of an advisory role, and we use the outside agencies to manage that.
Yeah, and likewise, I know that there's, in terms of tweeting the Mayo Clinic jobs, that our HR group contracts with somebody else to help create a feed that comes off of our new job listings, so people that are following that. So there is a point to actually using it as a broadcast tool. I mean, that sometimes people go, ooh, shouldn't be using it one way, that's bad. Well, sometimes it's real, people are interested in finding out, I'd like to work at Mayo Clinic and I want to track the new jobs that are there. And so it's meeting a real need. Likewise, that's our 8 people on our staff are here to help and consult and to give ideas, but within that work unit, in this case HR is the work unit, they need to develop what their strategy is in consultation with us, and then they do the execution. Right, they drive their own, we do the Mayo Clinic account, the Mayo Clinic Facebook page, and the Mayo Clinic YouTube channel, and our enterprise level blogs, but if a group wants to start their own blog, we'll give them the platform and the training, and then they're responsible for making it go with just us as administrators who can step in a rescue kind of way, or an emergency if we see something that we can act on it.
And I can't believe I didn't remember this. About 2 months ago, we launched a nurse recruitment Facebook page where we have 8 different nurse ambassadors who are admins of the Facebook page. And set up videos where you could meet them, get to hear about their experiences working at the hospital, and they take questions. So they'll pick out the particular nurse that happens to be their specialty. They ask a question about what is the life like at our medical center, what are the opportunities. They have that conversation back and forth. So it's starting off slow, but our nurse ambassadors get a lot out of it. They are proud of working at our hospital. They want to share this information, and they're getting questions coming in from people who are their peers.
Yeah. Okay, well, these two, and then we'll
finish.
Okay, sorry. Go ahead.
It was just a side note, because so many physicians and healthcare organizations almost feel obligated to talk about healthcare content and education, et cetera. Yet I found one of the most useful objectives is to humanize my presence, to humanize my organization. And, you know, it just raises the comfort level of patients and people with me and with my practice enormously, so that those 2-3 minutes of a patient sitting there in your office and they're nervous, do I trust this guy? Am I going to understand what he's going to say? You know, they've already read through my content, they've seen my videos, they know my approach, they understand me. And just the advantage of humanizing yourself and having that patient comfortable in your presence and in your office is, to me, almost outweighs the benefit of the education in some respects. And they are by far the most popular blog posts and Facebook posts or Twitter posts that I have, are those that humanize me and my existence, whether it be, you know, a post about me or my family or what I am outside of medicine.
I think you're absolutely right, and I think part of that is you're so much the exception. When really, most doctors are not comfortable sharing that kind of personal information, personal insight, your thoughts, what you're enjoying, the kind of what sports you do. So I think people come to that and they are surprised and they're very pleased to be able to get to know somebody at a human level.
Okay, last one, and then we'll, yep, that's you.
Okay. Hi, David Flores, Social Media Manager at Albert Einstein College of Medicine. And I just was wondering, one thing that we're finding is that that question of time, how much time it takes, is a question we get from our faculty, and you know, some of whom are physicians, some of whom are physician scientists, and now they're asking for training. They're asking for, how do I write a tweet? You know, are you spending a lot of time doing that? How do you go about doing that?
I send them to Lee's site.
Oh, we send them to Lee's site too, but then we still get the question.
No, we are there to assist any physician who comes along asking about this. And part of our training, as we go through and we meet with different departments and we explain what we do with social media, is to let them know that our role is to be a resource for you. That if you have any questions about how to do this on a personal basis or a professional basis, come to us. We'll take all the time we need to take care of that.
Thank you.